from a Children's Services Council standpoint, I have two other examples. One being the dental program for kids in schools. So as a roundtable member, the idea of the steering committee bringing issues forward, because the steering committee consists of all the number twos, hopefully. I wasn't the number two, but I was on the steering committee. I don't know why. We don't do math well.
You got stuff done, Chuck.
But it's also, I digress, but it also included all the people that were doing direct services. Because as a Children's Services Council, we don't do direct services, we fund direct services. So it's easy to make decisions in a vacuum unless you get the data and the input from the people that are actually on the ground, which is what the Roundtable does. It provides all that data and that research, the focus groups, all that data collection. But I remember the steering committee said, hey, this is an emerging issue. And it was the fact that kids can't learn when there's significant dental decay. And I think it was C.A. Moore, or Dan McCarty, it was like well over 50% of the kids. And they came with pictures and everything. It was dramatic. And so as the Roundtable, we have an emerging issue. And sometimes as the Children's Services Council, I feel like when there's an emergency issue, everyone's like, well, CSC should fund it, right? But our money is not endless. And we have priorities too that align very closely with the Roundtable. But that issue was put on the table, and it was the school board, the Children's Services Council, the United Way, and the health department all figured out a way to make that resource available to start addressing that issue. And that program continues today. Another one, it's a small one, but I remember it came up in the steering committee that, daylight savings time, I always forget which is which, but when kids are walking on the streets and it's dark out, they were getting hit by cars because there's not enough sidewalks. Now, the Roundtable didn't say, hey, let's make sidewalks, and we all went and did concrete. But the fire department had an idea of what if we issued out little reflectors that kids could put on the backpack. That was an issue that was unknown to us at all until it came up through the steering committee and brought to the Roundtable. That was like a $3,000 fix to save a child's life, right? The fire department brought it up, and at that time, Kathy Basile was like, we'll fund it, our CEO. So it's those kind of issues that, and also when we think we're going to fund a program at the Children's Services Council, right? We're like, we're going to do this. Every program has an unintended consequence, right? We may fund a program, but there's no way in heck they're going to get into the schools, right? Or, it may impact Department of Children and Families. So when we talk and we have those relationships, we can discuss those. And then just the mere fact, I interact a lot with my counterparts across 11 counties, came from Chicago. It was unheard of for somebody in my role, for example, to be able to have the cell number for the sheriff, or to be able to talk to the superintendent, or to know exactly who was in charge of what. And I'll give an example of what you all already reiterated. I had to speak, I was a plenary, I don't know why they chose me, I was a plenary speaker at the Ready by 21 conference. It's a national conference every year for those practitioners that are working from children 0 to 21. And I was going to talk about the Children's Services Council funding model, because that's what they asked me to talk about. But when I sat in every single workshop, they all kept stressing, every community needs to form what they call a children's cabinet, so that when you make decisions, it's well-rounded. And when they were talking, I'm like, this is a children's cabinet. And so 5 minutes or like half hour before, I was like, I talked 10 minutes about Children's Services Council and a half hour about the Roundtable and all the work that we do, because this is a best practice model that they are urging every community to do. And I do think that we take it for granted because it's been here for 30 years and it's like, oh, it's another meeting on my calendar. But the impact that it's had is tremendous.
Well said.
Judge Connor, do you have anything to add?
I'd like Chief Wilson to go before I do.
He'd like for you to go.
What I'm going to do is I'm going to make it real quick for the judge. So he don't jump up and try to go out. I'll be done in a minute. But I'm retired now. I've been retired for about 3 years. And this was one of the best things about my job, was our ability to get together and work together and do things like Sean said, to be able to pick up the phone. And if I want to talk to the fire chief, I know how to get in touch with the fireworks so we can do things with that. And I think our greatest asset was the people that you've heard from today about, and it's all about the communication and what we can do with the communication. Doesn't matter who it is, as long as we can communicate and get things done, it's going to make things better for us no matter what. And we did a lot of good things dating back for a long period of time. And I mean, it's very nice for me to sit here and get reminders to things that we were all involved in at the time. I do get together with Vern every once in a while to reminisce about other things, but that's a whole different story. But I think you can see just in this conversation back and forth that this is how we get things done. It's working every day. Problems are still going to rise up, and you're going to have to deal with those problems when they come. But as long as we have open communication like this, we will be successful. There's no question about it. And it's actually I'm very glad to be here today to sit down with people that I worked with for years. When I was on the Children's Services Council board, I'm still waiting to hear from the governor. I think he's busy right now, though. But we got a lot of stuff done then, and there's a lot of stuff to get going into our future. And it's not going to happen if we don't do it together and work together like we've been. And these are just examples of the work that went into it, but it's very successful for everybody. So I think that's it.
Cut that part from the video too, the governor part.
He's serious.
I'm editing as I go. I'm dead serious.
My turn?
Yes, sir.
So, when I got into juvenile court, I very quickly realized there's all this need, and there's never enough, anything close to the resources to deal with the problem. So I get invited to the roundtable, and I've learned a lot of history today, and I will tell you, I feel as inspired today listening to what all has happened since I was involved as I was when I first got on the roundtable. And the roundtable grabbed me and inspired me. And when I think back about it, I realize that it was the roundtable that first taught me the power of collaborative decision making. And there's been a little discussion about collaboration or whatever, but and what I came to understand, thanks to Nancy Brown, Vern Melvin, Kathy Basile, Sean Boyle, and all the early people that had got this ball rolling before I ever came on board, is, part of that secret sauce was the fact that everybody got to know each other, these agencies that typically never worked together or whatever. But more importantly, what grabbed me is the fact that at these meetings, it was clearly understood it was important that nobody's protecting their turf, okay? Each agency doesn't have any turf protection. And then the other thing that the early roundtable figured out is all these agencies, all these entities have an area of expertise dealing with kids. And, when you can sit around the table and discuss this, and it had to be the CEOs because, again, it was incredibly important that it had to be the top people. Because, again, you've got limited resource. You get so much bang out of the dollar when there is collaborative decision making. And that was the beauty of it. All I can say is that, the other thing about collaborative decision making, not only does it allow you to share expertise, but as Sean mentioned, you avoid unintended consequences, because that is what would happen is one agency would say, let's do, and then the other agency, yeah, but if you do that, then that's going to create this problem for us or what. And it was that sharing of information, sharing of data, which really made it so successful. So that's why, and there's a question about, looking back, what did you do wrong? Quite frankly, I wasn't on it long enough. It was, I don't even remember how long I was on it. It was at least probably 4 or 5 years. But so I don't, like Vern, I don't really remember. I'm sure I probably did make a lot of mistakes. But what I prepare.
Judge, I remember recently you mentioned that your experience on the roundtable and the collaborative experience and that sort of thing made an impact on you whenever you became an appellate judge.
What Vern's referring to is I shared with him that, again, it's there were two other involvements I've had as a judge over the years that taught me, again, the power of collaborative decision making. I won't bore you with the other two, but this was the first one. But what Vern is alluding to is, when you're a trial judge, you're the lone ranger sitting in the saddle, dealing with things. Whereas at the appellate court, I have to work with two other judges on a panel. All the court cases, it takes 3 judges to resolve the case or whatever. So again, it was the power of collaborative decision making that persuaded me. I want to move from the trial court to the appellate court because my job now is collaborative decision making. So,
Thank you. And Clint, do you have anything to add?
Somewhat of a different perspective. So I've been in my current role for 10 years. And prior to that, I was the Assistant County Health Department Director. And Larry Lee, who was the administrator before that, he asked me to be part of this steering committee. So it's kind of like the same time Shanique was getting into her role versus a prosecutor, then pulling her into this role. But from a health department perspective, a few names that I will share with others that will bring up some memories was we had Diane Walgren, Carlette Peck, Donna Harris, Angela Roberson, Trish Goulet, Beth Pitana, Sonia Gabriel, Rhonda Cerulli, myself. I say that in the fact that there have been 10 of us who have been in a leadership role in the roundtable. Mm-hmm. This position has no terms. Steering committee, we have 1-year, 2-year terms. That from a value perspective, we see value in it. I mean, today there are 4 members of the health department who are here today, not because they don't have anything else to do, but we see value from a health department perspective to be engaged. From a disaster perspective, here's a term that I wrote down that, chiefs will remember and do know is during a disaster is not a time to exchange business cards. Yeah. Now, not that this is a disaster, but having an opportunity to meet people and to foster new relationships and to see friends and to just network. This is a great avenue for us to share trainings, share experiences, even during public health emergencies. My COVID was different than anyone else's COVID. And we can all say that, but during those 2 or 3 years that I had a good opportunity, just through the roundtable to push information out, through Pastor Mills and through Lincoln Advisory Council as part of 100+ presentations that I did. This was just another one that we're able to reach different audiences. And again, as everyone else is already mentioning, it's a way where we can address our own priorities. And selfishly, there's a lot that we get involved in from a health perspective that covers a wide variety of areas, and we can bring it to this roundtable to help address our priorities.
Thank you. And we have about 5 minutes left. I